Okay, so I decided to wait and do my day 2 and 3 video together. Day 2 was actually really short. I only worked from 8:30 a.m. until about 1:30 p.m. because our final surgery was canceled for the day. I was actually with an orthopedic surgeon along with the anesthesiologist Alex that I was with on day 1. Our first patient had a wrist fracture in the radius. It was a block anesthetic. They were localizing the axillary artery and nerves around that. The patient had rheumatoid arthritis, and the arm is usually flexed for the block, but they had it extended, which made for a bad block. So they were given Proferol for a large amount, will produce apnea. Atropine, we already done that. And then Ringer Lactota, which is pretty much just a clear liquid to push fluids through the system. The drugs were administered intravenous. There was also bupivacaine and levobupivacaine included. The levobupivacaine is safer than the bupivacaine. Those were mentioned in the first video. The block was definitely bad, so we gave her more Proferol and some fentanyl to reduce her nerves. If you open the jaw instead of inserting the cannula on this patient, so there was no obstruction to the airway. And the oxygen mask was put on until the Proferol fully took advantage. She was later given Europril for the hypertension, and that was given intravenous. The oxygen was via the mask when the O2 dropped below 89. There was a plate inserted to fix the fracture, and there were 3 different screws. There was the one on the plate, one from bone to bone, and a pin or nail-like structure. Patient 2 also had a block anesthetic. He had necrotic bone, no blood. The disease name is Kimbach. I'm going to look more into that. It was on the lunate bone. So he was given Proferol. The stages of Kimbach, the first stage is pain. The second stage is like more white in an x-ray. Third is shrinking, and 4 is changes in the surrounding bones. So it was osteoporosis, and the cause is unknown. The surgery was an osteoectomy. It was for stage 1, you can also do a vascularized bone graft, but only in, like I said, the initial phase, which his was further. There are also no PAs or assistants in the surgery room. There are only the surgeons and surgical nurses. They actually don't have PAs. So the healthcare system in Spain is actually free, but not really free considering their taxes pay for it. But anyone in the surrounding European countries that are part of the union, they can go through that. And the schooling to become a doctor, I haven't found out about the nurses yet. They graduate high school at 15 and then take an exam and then immediately go into medical school after that exam and go for 4 years, and then they take another exam, and specialization can be 5 to 6 years. So they go about the same amount of time as we do in the States, except they are younger doctors because they graduate high school at 15 instead of 18. So going into the culture, today we went to Valencia. We viewed the cathedral and some of the older buildings. We got to see from the Roman times where they came in and established Valencia, a city being 2,000 years old compared to the States just being over 200 years old. That was very interesting.